Welcome to another episode of the Healing Wellness Show. I'm your host, Dr. Karim, and today we're going to be diving into a topic that affects millions of people. That's neck pain. Whether from poor posture, an accident, or just the wear and tear of daily life, neck pain can be deliberating. And joining me today to share expert insight and relief solutions is Dr. Sharp, and she's from Family and Sport Chiropractic in North Liberty, Iowa, and she was on our show last week, so I'd like to welcome her back. So Dr. Sharp, thank you for coming back.
Yay, thank you for having me back. I had such a blast last podcast. I'm excited to be here today to be able to share information about neck pain and how we can better understand how to get the relief that we need.
Excellent. Why don't you let our listeners know a little bit about you, where you're at, and a little bit about your story, just for these new listeners that didn't listen to your show last week.
So everybody, I'm Dr. Sharp, as Dr. Karim stated. I have been a chiropractor since 2016, graduated from Palmer College in Davenport. One thing that led me into chiropractic was having that secondhand experience from seeing my sister and my mom get adjusted. My mom and I were in a car accident when I was really little. She had suffered from some whiplash injuries. My sister, her and I played sports growing up, and she dealt with a lot of knee, ankle injuries. And so they both went to the chiropractor, and I saw secondhand how it helped them. So I knew that I wanted to get into more of a holistic form of healthcare in chiropractic. And that's just where I was led to go. So now I am here at Family and Sport Chiropractic, and I love it. We have a wonderful team on our staff, and the environment is so great. And we've been able to come across and see a lot of patients that have dealt with a multitude of things in our office.
Well, thank you for sharing. Appreciate it. And today we're just going to be taking questions from patients. I'll be asking some common questions, kind of waiting for these questions to pop up. But Dr. Sharp, why don't you tell us what are some of the most common causes of neck pain that you deal with in your clinic?
So that's a great question. Kind of going off of what transpired me into chiropractic care, whiplash injuries. That is such a big thing that we see coming into our office. And that's something that we can definitely address. Also, people that come in that tell us maybe they slept wrong in their bed, or maybe they fell asleep on a couch, you name it. So that's another good one. And then also just headaches, dealing with neck issues that are stemming from spinal misalignment specifically.
So can you explain a little bit about how a spinal misalignment might cause that headache? Or, you said maybe sinus problems or ear infections like in kids, so can you kind of walk us through that process?
Yeah. So, going off of like ear infections, we've seen a lot of little kiddos that have dealt with that. Most specifically, so in our neck, we have 7 vertebrae. Typically the upper neck, our atlas is our C1 vertebra. Anytime children come in that have been dealing with ear infections, that's the main segment that I always like to look into, just because there is this correlation where it is so close to our eustachian tube that if it is misaligned and if it's not in the right place, it can put pressure on that area. And then if we do find that it's stuck and we get it moving, it can open up that area and allow the fluid to drain. So that's a good scenario that we've seen with ear infections specifically. But really with the neck, if anything gets misaligned, it can put pressure on our nerves. Our spine is connected to our brainstem. So if we find something where there is a misalignment, there's some disconnect going on where everything is not working appropriately. So we want to find where that's happening and address that area and figure out what the root cause of why they're maybe dealing with those headaches. So that pain over time, when something gets stuck, our muscles start to get tight and tense. And a lot of patients end up coming in with tension headaches, and that's stemming from the tightness in the muscles that they've been having. And then that all just ties together with the neck. So if we get those areas that are stuck moving better, it can allow for better circulation to those areas. So really anything that gets misaligned in the neck can eventually affect our shoulders, affect our arms, affect our hands, and basically any organs in those areas. So going back to what you mentioned earlier, the sinuses. So really like the sinuses, the ear infections, the headaches, all can be things that stem from the neck. Granted, there are external factors that can also play a role in those. But as far as what we know and the evidence that shows with chiropractic care, there's a lot, all of those things we can help with.
So basically, you said that the neck nerves, they innervate anything in the head. So that's why some people might develop headaches, ear infections, sinus problems. And by correcting that, we can get rid of a lot of that. Also, you said it kind of goes into your arms, kind of into your hands. So that's all the nerves coming out of the neck area.
Yeah.
Okay.
Yeah.
Well, excellent. Excellent. Thanks for sharing that. So why does neck pain seem to be persistent for some patients is what one of the audience asked here.
Yeah, that is such a great question. A lot of people that come into our office, I find that maybe they miss the early warning signs of what they've been dealing with, because pain is usually the last thing to show. So a lot of people kind of wait until all of a sudden they're in pain and think, oh, I just now started having this problem. But a problem could exist way longer than that. Most of the time when we do feel like we had a lot of discomfort, we resort to medications, which medicine definitely has its place. But sometimes we maybe want to use this medication and it's just masking the symptoms and it's not really correcting the issue.
Okay. Well, can neck pain be a symptom of other health issues?
Yep, it definitely can. Going back to what we talked about a little bit ago, with the headaches especially, really it can stem or lead to other issues to occur. So the headaches, the shoulder pain, the arm pain, the hand pain, all of that can be attributed to neck discomfort. Because again, if the neck is misaligned, like you had stated earlier, all those nerves innervate, control different parts of the arm and the hands and the fingers. So certain areas that do get misaligned, if we can adjust those and get those moving better, it can allow reduce inflammation, get more blood circulation going back to those areas, and just really honestly help and get more mobility, which is what we want, more mobility in the spine overall.
So what you're kind of saying from what I'm getting out of you is if it's a neck problem, so it's a bone, so it could be a bone, a nerve, or a muscle issue, or all three together.
Yeah, essentially, yeah. They all play a part together. So if that vertebra gets out of alignment, then the muscles can react. The muscles might be tight. The ligaments, are impacted as well, just like you said. And then we want to figure out where that's happening and get that bone moving in the right direction so it can just continue to take pressure off the nerves. So then in turn, over time, the more and more we keep adjusting patients, they will eventually have less discomfort and better mobility overall.
Okay. Well, since we're kind of on the topic, how does chiropractic care address like root cause problem like neck pain?
Yeah, so going back to that, if we can get the bones moving in the right direction, it can reduce inflammation. The muscles also have involvement with that as well. We can restore the alignment of the spine. And then really we can also try to provide more like strengthening and exercises and dive into more and look at that more holistic approach to care and combine all of those things.
So why don't you walk us through a neck pain patient walks through your door? What does that kind of process look like?
Yeah, so usually we'd have a patient come in, we'd sit down and we'd have a consult. We'd do like a more deep, in-depth, try to figure out their history. And then we would do some orthopedic tests, some neuromuscular testing, take some x-rays if need be, and then figure out a game plan and go from there.
How quickly can a patient find relief from neck pain?
That's a great question. I feel like I get that a lot with new patients coming into the office. It really just depends on that patient. Some people notice a difference right away. Some people, it takes a little while. It really just depends on their whole history. If they've had a chronic issue for a long time, it's going to take somebody a little bit longer, most likely, to notice a difference with dealing with this chronic issue. So it really just depends. Sometimes it can be really quick. Sometimes it might take take several weeks to notice a difference.
Just depends on the person. Okay.
Yeah.
So can you tell the audience here, because I keep hearing about this relief protocol. Okay. Can you walk them through what is relief protocol? Because I've heard that multiple times. They're asking about it. So they probably seen it on your website. So why don't you walk them through what relief protocol is?
Yeah, so we do a multitude of things with our relief protocol. And the first thing that we'll do is a digital posture scan. This will really help us to identify any spinal misalignments. We will also do chiropractic adjustments. They will be gentle and will be targeted adjustments to help restore mobility. We also do have a class 4 laser therapy that we can also apply. This will help to reduce any inflammation, and it really helps to stimulate healing overall. We also have like neck decompression therapy. This is a great thing that can help to relieve discs, the pressure on the discs and the nerves to allow for better healing. We also can do myofascial release. This will help to loosen up any tight muscles, contributing to discomfort. And then we can dive into more like therapeutic exercises. These will help to strengthen and stabilize the neck muscles specifically. And then we also like to incorporate some like ergonomic coaching to make sure, what are you doing throughout your day? We can try to talk to a patient to see, do they have a desk job? Do we need to adapt or adjust anything, or dive into talking about what they might need to do to adjust? Sorry, I just started laughing.
Something on my face?
Okay.
Wow. So that's super comprehensive there. So does the protocol, is it customized per person, or is it the same every neck patient? That's what we're doing.
It originated from in their daily habits. They really differentiate. So we build every plan according to that. So it is very customized specifically for each individual.
And what determines that it's customized for that person compared to that person? Like what? How can you distinguish?
Yeah, so it really just determines on what they come in with, what they present with. If it's somebody that comes in with that maybe has a history of some spinal fusions in their neck, maybe we adapt their plan according to that because we don't want to necessarily adjust those spinal fusions, but we can work around that. Versus somebody that doesn't have any spinal fusions, maybe we can do a more in-depth approach and be really aggressive at first to get things moving better and get that patient out of discomfort faster. So it really just depends on if they've had an acute issue or more of a chronic issue, how long they've been dealing with this.
That makes sense. What are some tips for the listeners to prevent neck pain?
Yeah, so depending on your job, if you are at a desk all day, I think I said dad all day. You're at a If you're at a desk all day, do we need to start over? Okay. So if you have a job where you're at your desk all day, maybe setting up your workstation with proper ergonomics, and then also taking more breaks throughout the day. If you find yourself sitting in a chair for like an hour, maybe trying to get up and move a little bit just to increase more blood circulation throughout the body. Also, maybe using supportive pillows, whether again, when you're sitting in a chair, maybe adding a pillow behind your back. And then even if you're driving in a car, maybe modifying your seat to make it more comfortable for you. And then again, in today's society, everybody's on their phones throughout the day, right? So trying to avoid constantly looking down is a major one as well.
Are there any home exercises or tools that you would recommend for someone with neck pain?
Yeah, so one popular exercise that we like to educate patients about are chin tucks. This is a good exercise to do. And then also just other neck stretches. And again, adding more cervical rolls or supportive pillows can help a lot as well.
I hear chin tucks are your favorite.
Chin tucks are interesting. I love doing the chin tuck. So the chin tuck, if you try doing this, it might, if somebody's watching you do it, it might seem uncomfortable or you might look kind of weird doing it, but you want to have a double chin when you do a chin tuck. That is exactly what this stretch should look like.
Man. So are there any important, or how important is stress management in neck pain recovery?
It is extremely important. Stress can really cause the neck and the upper back muscles to tighten. So doing more like deep breathing techniques, meditation, and just physical activity can help a lot.
Okay, I'm going to go back to a question I was asked earlier. Can you walk us step by step, like someone wants to make an appointment with you. What is it that they're getting for their appointment? How long is it going to take? And really, what is it that you're looking for, or that you could provide for the patient?
Yeah. So when a patient comes in, typically for their first visit, we will do like a posture assessment, and we'll do like a range of motion assessment at that visit. And then we typically like to get the patient back within 48 hours because we want to help the patient as soon as possible.
So what are you getting out of the posture assessment or the range of motion? Like, what kind of information?
Yeah, so the posture assessment and the range of assessment is so important. We use that as a part of our tool to figure out where the restricted mobility is occurring. We can also look at, does this patient have anterior head carriage where their head is jutted forward over their shoulder too far? Maybe they have one shoulder that sits higher than the other. Maybe they have a hip that sits higher than the other. It's hard to say this 100%, but part of that could be compensation for something that's going on in the spine, or it could be due to a misalignment occurring in the spine as well.
Okay. And then after the posture scan and the range of motion, then what?
Yeah, so after that, we typically will get the patient scheduled for a follow-up visit. At that next visit, we will do even further testing to really dive deep and figure out what the root cause, where that's stemming from. And so at that visit, we'll do, again, a more detailed history, and then we will do some orthopedic testing, some neuromuscular testing, and we'll take full spinal x-rays. We also do motion study x-rays, which is super, super cool and very unique. I have never heard of any other place doing this. So that is something else that we've implemented, which is super beneficial. It's just another way to see where the spine is stuck and not moving. That way we have a more specific approach to care and know really what area to zone in and really focus on more. And then we also, at that visit, we try to get a feel for the patient to see, is this something that they've been dealing with for a long time? Is it something that they've just started dealing with? And really diving in and figuring out, are we wanting to try to just continue on a path where they've been doing, maybe just helping manage the symptoms? Or are we wanting to take a different approach to care and doing more of the rehabilitative approach to care, where we're really trying to address the root cause of the issue and trying to eventually transition into preventative care, essentially. So that is what the first visit would look like.
That's all in the first visit?
That is all in the first visit. So it is very thorough. We do a lot. A lot of patients afterwards, they even say that. They say, wow, this is the most thorough chiropractic place that I've ever been to. This is great. This is awesome.
So that's what we're talking about when you guys talk about comprehensive tests.
Yes. Yeah.
So how long is that? Is that like 15 minutes, 30 minutes?
So we actually spend about an hour, give or take. It could be more, just depending on, if the patient has a lot more questions they want to ask us. We usually set it up for about an hour, but just like I said, it could take a little bit longer than that, just depending on the case. So that is all in day one. So very thorough, comprehensive. And then day two, we'll usually bring the patient back, and then we'll go over all the results with the patient. So we'll sit down, we'll go over the x-rays with the patient. I always love doing this with patients too, because I feel like they have more of a visual to really see what's going on. Most of the time I get that aha look in people's eyes where they're like, wow, okay, I had been feeling that, and now I can visually see what's going on and put it to how I've been feeling. So that's something that we'll do. And then again, we'll customize a plan. We will work as a team with the patient to figure out what they're looking for out of this care. And then we will get them adjusted, which I feel is the best part. I'm sorry.
So get them onto a plan. And how long does a plan usually look like or last for?
Yeah, that's such a great question. I feel like, again, it just depends patient by patient, what they have going on. If we go that more acute route, that could be a little different plan. If we go more the rehabilitative route, where somebody comes in and they really want to figure out the root cause of why they're dealing with these issues, we can formulate a different plan. So it's kind of just case by case. But I will say, again, it really just depends. So we could have a patient that comes in here that's been having a lot of chronic issues. Maybe they are coming in to start off the bat 3 times a week for so many weeks, because we really want to address the issue as quick as we can and get that patient out of pain as fast as possible. So there's a couple different stages that we'll go through with the patient as far as care. We want to get them out of pain or as close to diminished pain as fast as possible. And then once we get to that phase, we can work on more of a stability phase, trying to help the patient keep their adjustments, hold their adjustments longer. And then after that phase, maybe transitioning to a more preventative care where it's still good to keep up on getting adjusted, because we're always going to do things in life that can lead to misalignments. So it's great to keep up on that preventative care.
Wow, that's pretty intensive there.
Yeah.
Yeah. So can you share with us then some success stories?
Yeah, we've had so many success stories. It's really cool at our clinic because we have this hallway where we have tons of pictures posted on the walls of different success stories or just different positive statements for patients that they've experienced throughout their care here at the office. So there's been so many great ones that I could share, but one off the tip of my head would be there was a lady that was coming in here that suffered from severe, very chronic migraines. We got her adjusted. She did several different therapy modalities. We went through that whole neck relief protocol, and it got to the point where the migraines were so intense that she just couldn't focus on some of the activities that she enjoyed. She liked to do yoga. It was limiting her from doing that. And so we got her to a place where things were moving better, and she was able to go and do that activity that she loved.
Wow. So our listeners here, great question. Do you guys have any special offers that you're
Yes.
offering right now for the listeners?
Yes. So actually, we're offering a free posture scan, and normally that's a $350 value. So this is such a great deal. So really, for any listeners who mentioned this podcast, when they schedule their first appointment, they will get that deal.
Wow, that's awesome.
Yeah.
That's a great opportunity right there.
Yeah.
Yeah. So you said it's free and it's usually $350?
It is free.
Okay.
It is free. Awesome.
Well, you've got the number on the screen. You can give him a call and schedule with Dr. Sharp. Well, Dr. Sharp, thanks for all the insights here. Anything else that you'd like to share about neck pain or tidbits?
Yeah, I mean, I feel like we dived into a lot of things, but I definitely appreciate you asking me to join you on the show again today. I had a wonderful time and always glad to share powerful insights with everybody. And for anyone experiencing neck discomfort, really this episode could be truly life-changing. So again, thanks for having me. And really, we just want you all to understand that you don't have to live with this neck pain, that you have somewhere you can come.
Well, thank you again, Dr. Sharp, for joining us today and sharing these powerful insights. For anyone experiencing neck pain, this episode could truly be life-changing. So again, thank you, Dr. Sharp.
Sorry, I think I read. Okay, I'm laughing.
You are
because
something today.
I read that line that you just read. Okay, sorry. I don't know. I just am in a laughing mood today.
So
It
yeah,
is.
it
Yeah, maybe
does.
that's what we need to talk about for the next topic.
There you go. Good idea. Well, let me just close it off here. Thank you again, Dr. Sharp, for joining us on the show. Probably going to expect you on another show or another topic. But to schedule your free posture scan and neck scan at Family and Sport Chiropractic with Dr. Sharp, you can give him a call at the number on the screen or visit North Liberty, Iowa. So stay aligned, stay healthy, and we'll see you next time on the Healing Wellness Show. All right. Thank you, Dr. Sharp, again for being on the show today. And we're probably going to have you on other shows and other topics. But to schedule your free posture scan and neck scan at Family and Sport Chiropractic, go ahead. You can call the number on the screen or visit the site. And stay aligned, stay healthy, and we'll see you next time on the Healing Wellness Show. I'm going to do the podcast blurb here. So are you or someone you know struggling with neck pain? Well, tune into this week's episode on the Healing Wellness Show. I'm Dr. Karim, going to interview posture expert Dr. Sharp at Family and Sport Chiropractic in North Liberty, Iowa. So go ahead and learn about the causes of neck pain, holistic treatment solutions, and the clinic's neck pain relief protocol. And a bonus, you're going to get a free posture scan for your neck, which is a value of $350 when you mention the bonus. Stay tuned and listen to our show.